Yes, having emergency care in fully functional hospitals in all areas of PEI is very essential. I think that our government has come a long way in healthcare on PEI, and we've certainly assisted in a number of areas, in rural areas, with our healthcare. We don't see, with the government policies we have and the hospitals we have functioning now, certainly I don't see any changes, and I want to continue to bring certainly emergency care and full health care in our hospitals across Prince Edward Island, and we have no intentions of changing that, only to work harder to make sure that these emergency units, emergency hospitals, and our hospitals certainly continue to function at the level they are, or at a greater level, and especially across rural Prince Edward Island.
Here you go.
I believe all islanders should have equal access to health care, whether you live in West Prince or whether you live in Charlottetown. The PC government has committed to keeping the ER open 24/7 at the Western Hospital in Alberton, and for my district, when I'm hearing door to door, that's a good thing.
Okay.
With taking that into consideration, I do believe, as well as the rest of the Island Party, that there should be 24-hour care no matter where you're at, and the hospitals that are open will be remaining open, and the ones that have closed under the current government will be looked at as the reopening under 24-hour care, with the emergency rooms under consideration as well.
Go.
Yes, government should be operation 24-hour emergency care. Our goal up here is definitely to keep our Western Hospital open. The writing is right on the wall that this previous government has planned on closing the Western Hospital at some certain point, and it's not that far down the road. But what I would do is go in and listen to the healthcare professionals, whatever their concerns and whatever it is, and bring it back to our party and see how we can work with them to fix the problem. Look, once again, we cannot promise nothing, but I certainly want to listen to the doctors, nurses, and whatever, anybody that's working in healthcare. Sit down and take it back to them. Take it back to our party, and then it starts from there. That's the process that I think we got to be working with. Listen to them and take our concerns back to Charlotte and come back and see what we can do for them. Like I said, our financials is in dire straits. This government is wasting way too much money, and you know what I mean. That's just me, but that's exactly what I would do, and I definitely will go to bat for anybody on the Western Hospital and healthcare, because every one of us deserve health care down the road, and right now, and that's exactly what I would do there.
Here you go.
Yes, it's very important that our rural hospitals have a function to play in our One Island community healthcare system. In my previous role as Mayor of Alberton, I certainly fought hard to ensure that Western Hospital remained open and a fully functional hospital with a 24-hour emergency room. And our government has made a decision that there's going to be one emergency department in Western Prince Edward Island, and that's at Western Hospital here. And of course, O'Leary Community Hospital still has a very important function to play in our healthcare system. That hospital has 13 acute care beds there, and the urgent center, and there's a $6 million addition built onto that hospital. And that hospital certainly has a very important role to play in their primary health care here in West Prince. But Western Hospital, of course, is the hospital that's in my district here in Alberton Roseville, and that's the hospital that I have fought so hard for to keep, and we've been successful in that in that quest, and Western Hospital is here. It has 24-hour emergency service. Our government is certainly committed to maintaining that 24-hour service emergency department service as we move into the future.
Hospitals and healthcare on PEI, I think the government should continue to keep all the hospitals open on Prince Edward Island, and that would include all 24-hour emergency care units that they have. They should continue those, and that's about all I can say about that.
2, 3, go.
On Prince Edward Island, in general terms, the general public always has an expectation that they want to receive every service in every community. But that becomes increasingly difficult as trends evolve in healthcare and in the school system. That it's very difficult to duplicate all the services in 7 locations. We have 7 rural hospitals or 7 hospitals on Prince Edward Island, and 3 of those hospitals provide emergency room services. These hospitals provide medical services in certain capacities. In most cases, you're probably going to receive about 80% of your medical needs right in your local community. In fact, here in O'Leary, we have a fully functioning medical clinic, we have 13 acute care services, and we have, in the future, we'll have 40 extended care services for our aging population. But to try to provide and duplicate that service in every location across Prince Edward Island just becomes quite a burden on the taxpayer. And beside that, it's very difficult to find the HR human resources needs that can fulfill those duties. And we, as a government, have to provide the patient safety and the confidence in the services that are provided, that those services are going to be done in a safe and effective manner. And although the general public would like to have surgeries, would like to have babies, it would like to have all those things within a few minutes of their home, we now find that that's probably not a realistic expectation. So I think it's very important that we provide the services that we have and maintain those services as best we possibly can in the foreseeable future. And in the end, I'm comfortable that we have that in the O'Leary facility and in Alberton and in Tyne Valley, but they'll all provide that need as best they possibly can.
3, go.
Yes, they should offer 24-hour emergency services. With an aging population, we need all the health services we can get here, which is sort of prompted my intentions for running. I see in the current government they sort of turned their back on rural hospitals, and I don't think it's fair to the people of rural PEI. We're citizens just the same as they are in Charlottetown, and we deserve the same amount of services here as in the capital.
Our rural community hospitals play a vital role in the whole healthcare system delivery by having the urgent care rooms at the extremities of the province, as well as having an ER, specifically in regard to West Prince. I'd like to focus on that, is with Tyne Valley, Western Hospital and O'Leary Hospital, Alberton being the primary ER center. All those hospitals and the doctors in them work as a complementary working group. So having those facilities still a vital role in the communities is a commitment that our government has made. Robert Giz made the commitment to keep the ER in Alberton open. We do provide urgent care services as well as a 24/7 on-call doctor at the other 2 facilities. And that is all part of the continuing role that those hospitals, specifically in West Prince, play in our healthcare system.
Go.
Cindy, the answer to your question, should government operate fully functional rural hospitals, including 24-hour emergency care? Talking to the constituents in the area, the people in the area would like to see the government maintain the current services we have.